So now let's talk about taking vaccination when you're in a treatment protocol with us. Like I already mentioned, if you're undergoing an IVF program with us, or you are on high dose of hormone replacement therapy because we want to perform certain investigations on you, namely endometrial receptivity array, to study the uterine lining and determine whether it's receptive or not. These are the common procedures we're doing at GG. And also whether you are already on a stimulation protocol and then your chance for vaccination comes, what do we do? So quick facts just to run through again and recap. Vaccination is not contraindicated while attempting a pregnancy in the natural way. There is no reduction in your time to pregnancy either ways. In case you wish to postpone pregnancy by 3 months, if you're a case of poor ovarian responder and you think you're losing time to pregnancy, it does not make a difference if you shift trying for pregnancy or undergoing an IVF program 3 months down the line. The emergency protocols of undergoing ovarian stimulation and actually harvesting embryos or oocytes or sperms per se are for patients with malignancies. So fertility preservation will see no delay in anything. But everything apart from that can undergo a bit of delay with no change in prognosis for achieving a pregnancy. So here's my quick take on people who are undergoing IVF program with us. Please remember that if I have put you on high dose hormonal pills because I need to do a testing called endometrial receptivity array and take a biopsy of the endometrium, you're going to be taking a lot of estrogen followed by progesterone. And we all know that there are physiological effects by using these hormones, which are generally not harmful. But in the event that you are undergoing vaccination or you've inadvertently contracted COVID, then we know that the pathophysiology of the illness per se are two things. One is a cytokine storm and the formation of microthrombi. So there is an underlying phenomenon of thromboembolism. So the intelligent thing for you to do is either you complete your procedure, hit the vaccination schedule, get it over with, and then come back for treatment. Or do the vaccination first, defer these testings to after the vaccination, and then come back to us. Like I told you earlier, by delaying your treatment per se by 2 or 3 months, even if you come under the high category risk of an aged individual or a poor ovarian responder, it is not going to change your prognosis, number one. Second is that those who have come to us for preliminary investigations and who are now trying for natural pregnancy with just minimal ovulation induction protocols and intercourse per se without doing an insemination, and who are not really visiting us at hospital should seriously consider getting themselves vaccinated. Now the third group who are undergoing treatment with us, undergoing IUI programs, like I've already mentioned, please discuss with us as to when you want to get vaccinated, and if you've already registered yourself. If there is a delay, you may as well try for pregnancy. But if your vaccination schedule is already in place, then discuss with us and we will let you know how to go about it. Now, for those who are undergoing ovarian stimulation to procure oocytes and then get them fertilized and form embryos and then go for the frozen embryo transfer program, all of these steps entail use of hormones, right? So this would be the intelligent thing to do. If you're already in an ovarian stimulation protocol, or if you insist and say, I want to undergo the procedure and then take the vaccination, yes, we will help you, provided you also cooperate by following all the safety protocols. You can finish your aspiration, that is, you can have your embryo formation, everything done and frozen for you. Then you take a break for your vaccination and then you come back for your frozen embryo transfers. There need not be a delay in this process. And for those who are awaiting their frozen embryo transfer, it will be ideal if you get vaccinated and then come for the program, because everything involves hormones and one really cannot assess and say, because of the sheer lack of data, what these kind of hormonal manipulations can do in the event you do develop COVID or you get some sort of, side effects of the vaccine, which are already known and which are not serious per se in a large majority of individuals. So having said this, please make your choice by discussing with us in great detail. And if you do let us know, then we can schedule it out for you perfectly. So there need not be fear, there need not be any sort of intimidation about taking the vaccine or about the treatment per se. We are here to support you in your choice. We cannot force you, but we can definitely open up your mind to the possibilities so that you will be able to go through a successful treatment cycle and hopefully reduce your chances of any sort of infection. So last but not the least, do we have preference of one vaccine over the other? No. So you can make your choice and just make sure that you get what is available for you right away. And make sure you get both your doses. You all know the time interval that you need to take between the two doses, which is different for both vaccines. And also, on a personal note, I would like for people to wait for about 2 to 3 weeks post second dose for you to achieve full immunity. So that would protect you further. It's my personal thing. But if you wish to come right away for treatment after the second dose, again, it's your call. It's your choice, and we're here to protect you for that. And please remember that just because you're vaccinated does not prevent you from getting the COVID infection. But because you're vaccinated, it is probably going to be life-saving. It's probably going to reduce the severity of the illness so that you get back home to your loved ones. And again, I think everyone has been emphasizing this time and again. Your safety protocols do not change just because you're vaccinated. Please make sure that you wear your mask covering your nose and mouth completely. Please make sure that you distance yourself really well, 2.5 meters at least. And then please practice your hand hygiene. So these things, I just cannot emphasize more on them. These are life-saving measures along with your vaccination, or at least until you get your vaccination, and then keep going through the same protocols. But I hope this video helped you. And if you have any queries, you can DM me, or better still, if you can email me, it would be great. All of this information is provided in the write-up below this video. Thank you so much, and stay home, stay safe, and take care of your loved ones.